Hi, today we're going to talk about civility in nursing. To understand civility in nursing, first you have to understand civility versus incivility. Civility is an authentic respect for others that requires time, presence, willingness to engage in genuine discourse, and intention to seek common ground. Incivility is a lack of respect for employees, patients, coworkers, and students around you, undermining caring and professionalism and intimidating and disruptive behaviors of others. So why is civility so important? Civility is important in nursing because it can influence patient outcomes, decrease sentinel events, decrease job stress, and decrease job burnout. So if with patient outcomes, with civility, if you walk into a patient's room and you introduce yourself and you open up that first line of trust and you have that civil relationship that's created between you and the patient, they're more likely to have a better outcome because they're more trusting of you. Along with that goes with the sentinel events. If you go into a patient's room and they aren't able to open up to you, then they're not going to be able to tell you when they're in pain or if something's wrong or not normal because they don't have that trusting relationship between you and them. So with civility, there's a decrease in sentinel events. With incivility, there's an increase in sentinel events. Sentinel events also can occur because the patient doesn't feel or the patient isn't getting 100% of your attention. So if you don't pay attention to the simple changes in their vital signs or the simple changes in their eye and nose, then you're less likely to catch something that could lead to a sentinel event, such as a death or a complication in their care. Job stress and civility go hand in hand. If a patient is not comfortable, or if a person is not comfortable in their job, and they don't feel like they're being trusted, or if they're not being treated with respect, they're less likely to be civil in that situation. And they're less likely to feel open and honest and have the communication built between them and their coworkers. So it just creates a constant stress of, am I doing this right? Am I doing this okay? Same with job burnout. If you're in a constant state of stress in your job and you just don't feel like you're engaged and you're not being treated with respect and everything else, you're going to feel more burnout about your job. You're not going to want to go to your place of work, and you're just not going to feel like you're important. So one of the main things that research has shown is that introducing civility early on to students has increased the amount of civility in the workspace. So if students are taught in school how to handle civility and incivility in situations where incivility is commonly seen, they're more likely to know how to deal with the situations on scene or in the workplace to decrease the amount of incivility behaviors that are seen. So for instance, it says here, incivility education at the pre-licensure level could also equip nursing students with assertiveness and tools to navigate uncivil behavior by current and future peers in the classroom and workplace settings. It is difficult for nursing students to learn appropriate professional comportment and responses to incivility when these behaviors are not modeled by more experienced nurses and when the student has insufficient tools to navigate uncivil encounters. So if they're not treated with respect, students are less likely to treat those around them with respect when they're in school and then after in the workplace, creating that barrier. Quality and safety education for nurses has 8 important topics, and 3 of the 8 that really go into civility is patient-centered care, teamwork and collaboration, and safety. Patient-centered care goes back to the patient being able to trust you and feel like you're advocating for them 100%, and you're giving them 100% of your attention and your care and your abilities. Teamwork and collaboration goes back to the job burnout and job stress. If you can't trust those around you and you can't work as a team and collaborate the care for your patients, then you're not giving them your full respect, and civility is not being seen in that situation. So it's very important to promote that teamwork and collaboration so that a civil environment can be introduced to your patient. Safety goes back to sentinel events and really showing your patients that you're there and advocating for them 100%. So the American Association of Colleges for Nursing also has many topics that they introduce. One of them is professionalism and professional values. So for the American Association of College of Nursing, they state that without professionalism, you can't have civility. And without civility, you can't have professionalism. So those two go hand in hand. So you cannot be in a professional relationship or professional situation with those around you in your workplace if you don't have that trusting and open bonding relationship with them in the beginning, which creates that civility and open connection with care and increases care and better benefits for the patient.